in. No, I don't have to do anything, right? Just okay. Hey, David, how you doing?
Hey, how you doing, Doc?
Oh, okay. David wants to talk to you, Doc.
Okay, Dave.
Tell you.
Sorry?
No, you're on. You can ask anything or say anything you want.
Yes, sir. I went in to see you a few years ago. I had shoulder trouble, and for like 5 years of pain, and it got to the point where I couldn't do anything. I went in to see you, and within 10 minutes, you took care of that pain. And I asked, when do I come back again? And you laughed. You said, you don't need to come back. And it's been 5 years.
Wow. Wow.
It's totally amazing. But I'm calling again because now I went to the doctors. They took a picture in my heel. I have a bone spur. And it's to the point where I can't hardly walk anymore. I was just wondering if you could take care of that.
Yeah, we'll take care of it in a minute. Just come in tomorrow.
I'm off on Thursday morning.
Okay, come in Thursday morning then.
So you could take care of that for me?
In a minute.
Nice.
Yeah, I've seen it. A minute.
What time do you open up?
9 o'clock.
Do I have to bring in the X-ray?
No.
No. He doesn't want to see it.
Okay. Thank you so much. I'll see you at 9 o'clock then.
All right, Dave. Thank you.
Thank you.
Thank you for calling me.
What?
I'm sorry. Go
You
ahead.
actually saved. I feel like you saved my life. You're a part of my life.
Oh wow, that's great.
That's
that
nice.
is so
How
nice.
bad the pain was. Thank you.
That's great.
That's
That's good to hear.
That's what a physician's supposed to be, part of your life.
Well, the gentleman we had on our show who came in.
Another Dave.
Yeah. This is a guy that looked like Bruce Willis, a good-looking guy, and he talked about how you saved his life because he's very athletic.
Yeah.
And he's in sports, and he said it's amazing. Why give up, folks? Why give up what you love? Yeah, if you love playing tennis, I had three people I brought in personally that they said they have tennis elbow. They walked out, and they're playing tennis the next day. One was playing basketball with his kid. I mean,
No, these are true stories.
yeah. Why
I mean,
give up? Why give up your life?
Some people think they know everything. They say, "Oh, that's not possible.
Yeah.
I have the best surgeon in the world." Well, you got a surgeon first of all, so you got to be careful there.
Everybody has the best surgeon. There are certain things. Everybody, no one's gonna say he's a terrible surgeon. Everyone says, "Well, I got the best." This guy is so big, you can't even get an appointment. Okay.
Yeah, I mean the whole thing is you can't get results by getting operated.
I have two doctors that are very close friends of mine. No, they both say we do everything we can to keep you out of the surgery room. Okay, because there's a lot of things.
But people are going to the surgeons, so they're asking for it. I mean, don't do that.
I will guarantee anyone that goes to a surgeon. Again, let me say something. The surgeons are very good at what they do. They've studied it. I'm not going to say anything bad about orthopedic surgeons, but
if they need it, they're
chances are you're going to get surgery.
Right.
Chances are you're going to get surgery. So you have two options. The thing is, we are not animals. We are people. We have options. Option number one is go and get the surgery. Option number two is don't get the surgery and feel better.
You can always get the surgery. See,
that's the point.
The thing. You can always get it if you have a failure of treatment. But let there be a failure of treatment before you get operated. See, you have to remember, we're teaching you. Failure of treatment means you might have to be operated, but don't go there first because you have to try the treatment first. We had the insurance companies. You mentioned insurance companies.
Right. I always mention them because I hate them.
Yeah. We had a guy come in my office and all bunched over. He couldn't even stand up straight. We took care of him and submitted the bill to the insurance company. And the doctor said, "Oh, you have to treat that for 3 months before you can do any shots." I said, "Are you out of your mind? This guy is self-employed. He was better the next day. He went back to work." They would not pay that bill. Therapy for 3 months, which is a scam. There is no such thing as therapy for 3 months. The therapists don't know what to do. They will not follow orders. And yet you have somebody saying, well, you need to do that before you can do anything. They're taking the doctor's part out of it.
Mm-hmm.
Now, what good are you if you're so fantastic that you can do something like that, and somebody from afar tells you you can't have it?
But everyone goes for therapy first.
You're paying the premium.
Yeah.
You got to have what you need.
But everyone goes to therapy when you go to an orthopedic.
Nobody-
The first thing you do is they send you for therapy. Why?
I don't know, because they don't diagnose. They have no treatments for you. We get around that sometimes by having a proper diagnosis and say there's no therapy for this diagnosis.
Right.
And it's true. And so sometimes they just pass it through. But the whole thing is just dumb. I mean, it's written by people who have no knowledge of musculoskeletal pain. So when you buy an insurance policy, make sure that I'm educating you now. Make sure that you don't have to go to therapy for anything. You can just go to the doctor. Let the doctors take care of you, not the therapist.
Now I could see by my good guys give me a notice. If you want to call Dr. Pannozzo,
Yes.
he's very accessible because he answers the phone.
Yes.
Okay, it's 561-381-5800. Call on your cell phone. It costs you nothing. 561-381-5800. We all have cell phones. Doc, I want to say thank you so much. Nick, thank you. Nutter, always thank you. And again, folks, have a great Sunday. And remember, you do not have to go for surgery. Make your second opinion your first.
You don't have to be treated forever either.
No. In and out.
If you get treated two times in a place, someplace that doesn't improve you, leave it, because they don't know what the hell to do. Excuse me.
You can
They
say
don't know
hell,
what
Doc.
to do.
Time to go, everybody, and thank you so much for joining us. Have a great week.
This has been the Dr. Pannozzo Sports and Medicine Hour with Dr. Anthony Pannozzo. If you spend 5 minutes with Dr. Pannozzo, you'll see he genuinely enjoys helping others. Visit Dr. Pannozzo online at www.paincentersnationwide.com or call him at 561-381-5800. Dr. Pannozzo will consult with you to determine the best solution to your pain needs. 561-381-5800 is the number to call, even if it's just for a second opinion. Join Dr. Pannozzo next week when he brings more important information on the physics of weight-bearing and engineer concepts for the body.